body turns that cinnamon raisin bagel or fish taco into smaller building blocks of nutrients. One of those building blocks is called glucose. Glucose travels into our bloodstream to different cells. Here's the catch. Our body needs insulin to help glucose get into some of the necessary cells. Without insulin, glucose can't do its job of saving energy for our bodies. Insulin and glucose work together to create stored energy, which is so essential for our bodies. In diabetes, our body can't make or use insulin properly, and things go awry. Stored energy may be broken down into too much fuel at a time when we don't need it. Types of diabetes. There are several different types of diabetes, but the two most common types of diabetes are type 1 and type 2. Scientists distinguish the different types of diabetes by what tends to happen inside our bodies in terms of insulin and glucose. In type 1 diabetes, your body destroys the cells in your pancreas, beta cells, that make insulin. Sometimes this destruction can happen quite quickly. This is why you may have heard about a child or adult rushed to the hospital and diagnosed with type 1 diabetes. Other times, the destruction occurs more slowly, such as in adults with latent autoimmune diabetes called LADA. In general, people with type 1 diabetes cannot make enough insulin. In type 2 diabetes, your body may have problems with the beta cells that make insulin or problems with the cells that receive insulin to do their jobs, or both. In other words, your body doesn't make enough insulin and your body isn't as sensitive to insulin, or a combination. The good news is that many people with type 2 diabetes are able to boost their production or sensitivity to insulin by making healthy lifestyle changes or taking medications. Therefore, you can do something about your diabetes. Some women get diabetes when they become pregnant, which is called gestational diabetes. It usually goes away after pregnancy, but you are more likely to have it with future pregnancies. Also, women with gestational diabetes are more likely to develop type 2 diabetes later. If you have gestational diabetes, you'll work with your healthcare provider to manage your diabetes during your pregnancy to keep you and your baby healthy. Diabetes worldwide. Around the world, 382 million people had diabetes in 2013. Type 2 diabetes appears to be increasing in every country. Source: International Diabetes Federation. Prediabetes. Some people have higher than normal blood glucose that is not high enough to be considered diabetes. It is called prediabetes. Half of Americans 65 and older have prediabetes, according to the Centers for Disease Control and Prevention, CDC. People with prediabetes may not have any symptoms, yet it's important to diagnose people with prediabetes because these people are at high risk for someday developing diabetes. And studies show that making changes to diet and exercise and even taking medication can delay diabetes in these patients. Prevalence of diabetes. The vast majority of people with diabetes have type 2 diabetes. About 90 to 95% of people with diabetes have type 2, while 5 to 10% of people with diabetes have type 1. You are not alone with your diabetes. In fact, over 9.3% of Americans have diabetes. That means 29.1 million people have diabetes in the United States, according to CDC estimates from 2014. These numbers are just estimates. We don't really know. In fact, many people have diabetes but don't know it. Roughly 8.1 million, or 27.8% of the 29.1 million people with diabetes in the U.S. are undiagnosed. Probably, if you're listening to this book, you have diabetes or know someone who has diabetes, and you want to do something about it. Who should be tested for diabetes? Adults who are overweight with a